Hey folks, it's Dr. Gerstmar from Aspire Natural Health. Today I just wanted to take a moment to talk about the Epipen controversy, if you haven't heard. So, an Epipen is a little pen, essentially, that's an injector of epinephrine, so an epinephrine pen, and it's used to treat severe allergic reactions, the kind where your throat closes up, you can't breathe, and you ultimately could die, which known as anaphylaxis, severe allergic reactions, which unfortunately are more common these days. And result in some kids dying. So this is serious stuff. So if you haven't heard, the company that makes Epipens got bought a little ways back and now have jacked up the prices of Epipens really significantly. So they're citing changes in insurance and et cetera, et cetera. And if you'll excuse my cynicism, I think this is just straight up greed. The larger conversation about how this balance between medicines which save people's lives, which in my opinion should be a public good, and the fact that many of these medicines are for profit, and so the goal and the intention is to charge as much as humanly possible and make as much money as possible. Bigger discussion for another day, but the bottom line is this, that the price of EpiPens has skyrocketed. So they usually come in a 2-pack for a prescription, and right now the price is running about $600 for that 2-pack. Now the pens last between 12 and 18 months, so for many parents, like for kids and such, that means a new pack every single year, and most of the time people need multiple pens, because this is something, if you have a severe allergic reaction, you can't go futzing around looking for that pen. You need to have it at hand. So that often means, one's going in a backpack or a purse to go with that person, one's often with a nurse, there can be one in like a glove compartment, there can be one with other figures around that person, so that EpiPen is available in mere moments. And so for some people, 2 or 3 packs at $600 a pop is, a lot of money. Now, insurance is sometimes picking it up, but in many ways, like we're seeing in a lot of places, deductibles and co-pays and everything are on the rise, which just means more out-of-pocket costs. So I wanted to take a moment. If you're in that situation, considering what to do, first of all, you really do need to have something like an EpiPen available, because these severe reactions, can and are life-threatening for people. So you need to have something available, but you have a couple of choices. The first is to get the Epipen. Now, I've been told or looked a little into this that the manufacturer does offer some coupons which can help, and if you meet certain income requirements and other issues, you might be able to get them for discounts or for free. So if that's you, I do recommend looking into those options that can help, especially if you can get it for a significant discount or for free. I want to say some people are holding on to old, or they're purchasing old or expired pens. I really don't recommend it here. They might still work, but the issue is they may not. And this is one of those situations where you can't afford to have it not work. So I know some people are trying to save money hanging on to older pens or buying from someone else already expired pens. Please don't do that. Instead, consider talking to the company and getting some coupons or possibly discounted or free pens if you can swing that situation. Now, you do actually have a couple of other choices, one of which is called the AdrenaClick. This is the generic version of the Epipen, and it is a cheaper option. So again, with some discounts, someone was reporting that they found these for $142 as opposed to $600. Listen, it saves money. It's a good choice. Now, the thing to keep in mind is that the way that the injector actually works are slightly different. So the good thing about the Epipen is it's made to be as easy as possible. You basically take the pen, pull the cap off, and you're not going to do it in your chest, right? But you just slam the pen down and you get the injection, which is great in an emergency. Now, the AdrenaClick, I haven't looked into the mechanism, but I've been told that it works differently. So please, if you're going to go with a different unit, one you have not used before, make sure you thoroughly understand how to use it, because it isn't one of those things when an emergency strikes that you want to be sitting there reading or fumbling for the package insert to figure out how to use the thing. Okay, so Adrenaclick is another option. Again, the advantage of these auto injectors like this is that they are relatively easy to use, because you do have a third option that is significantly cheaper but much harder to use. And that is simply to get a syringe and a vial of epinephrine. So again, the Epipen and the Adrenaclick are already prepackaged, they're ready to go. The manual version is having a vial of epinephrine and a syringe and needle, and going ahead drawing the epinephrine out and then injecting it manually. This is significantly cheaper. People are reporting that they can get the syringe and the epinephrine for about $10. So significantly cheaper, but the real downside is much harder to use. Where the Epipen and I'm assuming the Adrenaclick are fairly simple and straightforward, the epinephrine syringe and needle, you can keep them preloaded, but it's suggested that every month, so again, some you're going to have, if this is a route you're going to go, every month you're tossing away the syringe and needle and redrawing a fresh batch, and it's advised that every 3 months you throw away the bottle and you get a new bottle. Now again, we're talking dollars here, so cost-wise it's still very effective, but more time and effort on your part to do this. The other side is it's not quite so simple. You're going to need to, use the needle and inject, which again, at best of times, many people have trouble with, especially if you don't have enough training and experience with it. And then in an emergency situation, it's 10 times worse. So I do not recommend going this route unless finances are truly prohibitive for you, because you must have epinephrine. Okay, folks, so you have 3 choices here. The first is to go ahead and look for coupons or apply to the manufacturer for discounts. The second is going to be to investigate the generic Adrenaclick. And the third, if neither of those are truly within your financial means, is to go ahead and get a bottle of epinephrine and a syringe and just be diligent about it. Now, the last piece I want to cover is all 3 of these. Even though the Epipen, the Adrenaclick are much easier to use than a syringe and vial, is simply that training is necessary. So some data, some study have shown that really everyone should be refamiliarizing themselves with any of these methods every 3 months. I know it sounds like a pain, but this truly is one of those emergency situations where if you need to do it, you should know how to do it, because no one wants to see someone die because they're fumbling with the unit or they don't use it correctly. So I recommend you please take it seriously. Make a note on your calendar to at least every 3 months take out whatever it is you're using, the Epipen, the Adrenaclick, especially the syringe and needle, and run through the instructions and give it a quick practice session. Just what you would do can take only a couple of minutes, and this is one of those situations where it is that important. All right, folks, so please don't use expired EpiPens to try and save money. Try and use one of the cheaper alternatives if you need to. Talk to the company, and please practice at least every 3 months. Once again, if you are using the cheapest bottle of epinephrine and syringe, we really do recommend you replace the solution in the syringe, replace that syringe every month, and replace the bottle of epinephrine every 3 months. This isn't something you want to expire or go bad. All right, the last piece for you folks is to remember, while epinephrine is crucial and critical, I recommend having it if there are any of these severe reactions in you, a family member, or a loved one. I also wouldn't be doing my job if I didn't say we also want to work on doing our best to try and reduce that allergic sensitivity as much as we can. I'm certainly not saying that we can necessarily get rid of or reverse these reactions, but we want to do everything we can to reduce that immune overreactivity, get the person healthy, and take care of as much as we can. And that is what a good, competent naturopathic doctor or functional medicine doctor will do for you. All right, folks, Dr. Tim Gerstmar with Aspire Natural Health. Our focus, we are experts at treating people with gut problems, autoimmune diseases, and other hard-to-treat cases. We're always working on educating ourselves so we can do better for our patients. Please follow us at www.aspirenaturalhealth.com and facebook.com/aspirenaturalhealth. Till next time, folks, take care.